Hello, my name is Cristina Ponte. I am an Excelsior nursing student. This assignment is for Nursing 209 Module 8 discussion. So I am going to review the caregiver's understanding by asking them to describe what they will do in case of illness or emergency, or provide a plan, a written action plan for caregivers that is caring for their child with diabetes. I'm going to provide guidelines on when to seek medical attention, such as blood sugar is above or below a certain range, if there are signs of dehydration or ketones in the urine, or if there's any other symptoms such as fever, nausea, vomiting, or difficulty breathing. I'm going to also teach the caregivers to monitor the blood sugar more frequently during this illness that their child has, and adjust medication dosage accordingly, following the doctor's advice. So the rest this video, there's two topics that I chose: nutrition and hypoglycemia for the patient that has diabetes mellitus. So for nutrition, I will inform them nutrition is an essential part of managing diabetes in their child. A balanced diet can help your child maintain healthy blood sugar levels, prevent or delay complications, and support growth and development. And I'm going to give them some key points to remember. Your child should eat regular meals and snacks that include a variety of foods from all of the food groups. So we'll go over the food groups: vegetables and fruits, grains and starches, protein foods, and dairy products. And what to avoid: avoid foods high in fat, sugar, or salt, such as fried foods, candy, soda, or chips. I will also tell them if your child should follow a carbohydrate counting plan that matches, your child should follow a carbohydrate counting plan that matches the amount and type of carbohydrates he or she eats with the amount of insulin he or she takes. Carbohydrates are the body's primary energy source and also affect blood sugar levels the most. You can use food labels, measuring tools, and online resources to help you count carbs and plan meals and snacks. Your child should drink plenty of water and avoid sugary drinks like juice, sports, or energy drinks. These can raise blood sugar levels quickly and cause dehydration. If your child is thirsty, water is the best choice. Also, your child should eat consistently throughout the day and not skip meals or snacks. This can help prevent blood sugar highs and lows and reduce the risk of overeating or binging. If your child is going to be physically active, he or she may need to eat a snack before and after the activity to prevent hypoglycemia or low blood sugar. To check, so now I would see if my caregivers understand the nutritional part. So I would ask them, give me some examples of foods that are high in carbohydrates. and how much your child should eat at each meal or snack. And that will check my understanding that the caregivers understand the nutritional part of maintaining diabetes. Now we're going to move on to hypoglycemia. So, hypoglycemia or low blood sugar is a condition where the blood sugar is too low and usually below 70. And in medical terms, it's 70 milligrams per deciliter. It can happen if your child takes too much insulin, misses a meal or snack, exercises more than usual, or has an illness or infection. Hypoglycemia or low blood sugar can be dangerous and needs to be treated right away. Here are some signs and symptoms of hypoglycemia or low blood sugar: hunger, shakiness, sweating, dizziness, a headache, weakness, irritability, confusion, blurred vision, seizures, or loss of consciousness is one of the symptoms. Now, if you notice any of these signs and symptoms, you should check your child's blood sugar with the glucometer. If it is below 70 milligrams per deciliter or just 70, that's the magic number. Or if you cannot check it, you should give your child a fast-acting carbohydrate. So what is that? 4 ounces of juice or regular soda, 2 to 4 glucose tablets, 1 teaspoon of honey or sugar, or 5 to 6 pieces of hard candy. Wait 15 minutes after you give that and check the blood sugar again. If it is still below 70, repeat the steps until it is above 70. Then give your child a snack that contains protein and a complex carbohydrate, such as cheese, crackers, peanut butter, and bread, yogurt, or fruit. This can help prevent the blood sugar from dropping again. If your child is unconscious, having a seizure, or unable to swallow, do not give anything by mouth. Instead, call 911 or take your child to the nearest emergency room. You may need to inject, if your doctor prescribes this, a medication called glucagon, a hormone that rises the blood sugar levels quickly. After I gave all that information for hypoglycemia, I need to check my understanding with my caregivers. So I would ask, please tell me what are some causes and signs of low blood sugar and how would you treat it? And this concludes my video. Thank you for watching. And I will also tell my caregivers, if there's any questions, always contact the medical collaborative help team if any questions about diabetes or pertaining to their child. Thank you.